Well, today marks the commemoration of World No Tobacco Day, and the day aims to raise awareness of the negative health, social, economic and environmental impacts of tobacco use. This year's theme, Tobacco, Threat to Our Environment, aims to highlight the environmental impact of tobacco. Dr. Mosima Mabunda is the head of wellness at Vitality, and she joins us now for more. Dr. Mabunda, thanks so much for your time. Welcome to Morning Live.
Good morning. How are you?
I'm very well, thanks. So just for those who may still be wondering in 2022, let's talk about the health benefits of quitting smoking. I mean, they are well documented, but obviously, even in spite of all the graphic images we see being printed on cigarette or tobacco product boxes, people still continue to smoke. So why do you think it's still such a difficult message to put across?
Thank you once again for inviting me. I mean, as you alluded, today is World No Tobacco Day. And I think it's important to just note that this day was created way back in 1987 to raise awareness around the harmful effects of tobacco. I mean, many people might not know this, but tobacco is the leading cause of preventable deaths across the globe, right? We're talking about 8 million people that die every year. And what is sad about that statistic is that 7 million people who die out of that 8 million are people who smoke. However, the 1 to 1.2 million are people that are exposed to secondary smoke. Why do I mention that statistic? It's just to say that tobacco is a challenge that we need to tackle collectively because we are all harmed by its effects. And the prevalence, just to give a sense of how big it is as a challenge, across the globe, 22% of the world's population are smokers, and South African statistics are actually quite similar. And where we see that typically, and people would have observed this in their day-to-day, that men tend to be the one that smoke more than women. The statistics tell us that for every one woman who smoke, there are 4 men that smoke. But the good part of it is that though smoking is harmful, one can realize benefits from stopping to smoke. And what I like is you actually start to realize the benefits shortly after you smoke. I mean, the WHO and various public health bodies have published extensively to say from the first 12 hours when you stop smoking, your heart rate and your blood pressure starts to respond positively, and you start to reverse some of the harmful lung and heart consequences that you would have experienced as a result of smoking. So it's definitely not all lost. Smoking is still a challenge. There's been a lot that has been done over the years to curb the prevalence of smoking, and one can see that the stats are starting to go down. I mean, an example is in 2015, we were sitting at 1.32 billion people who smoke. Right now, it's 1.3 billion. That's still a big number, but at least we can see a decline, which is why days like today, when you see a healthcare professional, you will most likely be cancelled around the harmful effects of smoking, and you'll be encouraged around how you can actually try and curb the habit.
So we look at those stats, and as you say, 22% of the population is a huge number, considering all the advances that have been made around campaigns that would discourage people from smoking, all the legislation that has curbed advertising of tobacco products and the like. Why is it that people are still taking up smoking?
Yeah, that's a very interesting question. I mean, there's various reasons why people are exposed to smoking. People observe cues. You see people do something and you do it. And sadly, people who try smoking find that actually it's addictive. And the interesting thing is smoking is addictive. It's well published that people who smoke actually are willing to quit smoking, but they struggle. It's not something that one can easily do on their own. Very few people can quit purely on willpower. And part of what makes quitting smoking challenging can be boiled down to these 2 things. One, when you decide to stop smoking, your brain needs to get used to living without nicotine, right? And that's when you start hearing people talk about withdrawal symptoms, etc. But the second thing is around your daily habits or daily activities of living. Many people who smoke have stacked the habit of smoking alongside other activities. Now, where you used to have a coffee with a cigarette, or when you're stressed, you used to use a cigarette to calm you down, you need to continue those habits, which you likely will continue, but without the smoking. So that whole concept of trying to adjust to life without smoking is not one that many people can achieve on their own, but there's extensive support that is required to help people smoke, which is why I like how the medical and healthcare industry has recognized the importance of people taking a personalized, multi-pronged approach to tackle the burden of smoking.
Let's talk to that, because what innovative interventions are there out there to assist those who want to quit smoking?
What I liked, which was highlighted last year at this very same day last year, World No Tobacco Day, where the WHO had a campaign that was really targeted at getting people to pledge to quit smoking. In that campaign, there were various innovative providers of smoking cessation interventions, many of which are technology-led. An example is what we see as a growing trend in digital therapeutic, where really healthcare interventions are delivered via a technology software. So an example of that is providers like your Quit Genius and other similar providers, where what they do is they combine your pharmacology, and typically that's your nicotine patches, replacement patches, and they also would leverage psychology, because I had highlighted earlier that nicotine is addictive and many people need help just overcoming that. They also leverage the power of technology to track key habits, to deliver cognitive behavioral therapy in a way that is accessible to individuals. So treatments such as those have actually been shown to have a high quit rate. And what excites me about programs such as Quit Genius is, like I mentioned earlier, many people who smoke, up to 70% is published of smokers want to quit smoking. People have tried and many have not succeeded. And to see such advances in science and technology that are geared at empowering people and giving people their help is actually quite exciting. And I really just want to leave people with a message that it is never too late, right? We live in a world with these innovations that are there to help us, lead healthier lifestyle. Do try and engage with your healthcare professionals. Try this innovative interventions, and you actually will likely reap the benefits.
What about vaping, Dr. Mabunda? Because a lot of people who are trying to quit smoking, some of them have gone on to take up vaping. So what is that, and how beneficial is it? And should we even be making comparisons between tobacco, smoking and vaping?
So that is actually a very good question, and I'm glad you asked. And I was quite careful to not say cigarette smoking all the time, because we know that the harmful effects of smoking are also stemming from the smoke itself. The beauty about science really is that all interventions are informed by guidelines. And in South Africa, the current guidelines in terms of smoking cessation do not support the use of vaping. And that's in many other countries, where we know that if you're seeking to stop smoking, there is definitely pharmacological interventions. You can speak to your clinicians. There is definitely cognitive behavioral therapy, psychology, and there's social support. There is no evidence that has been validated that says that vaping is helpful. It's actually harmful. There's tons of evidence that shows that things like vaping and this water pipes, such as hookahs, also cause harmful effects. So it's not just cigarette.
So, Doctor, just on that note, because I know that's particularly prevalent and popular with young people, the hookah pipes and, smoking that. What are the harmful effects of those water-based smoking pipes and smoke that people inhale from there?
So the harmful effects of smoking include, like we alluded earlier, smoking harms your cardiovascular system, your heart systems, increasing your risk of things like strokes, heart attack. Your lungs get affected quite badly. We hear people that suffer from chronic obstructive lung diseases. So smoking sadly damages various parts of your body, and part of what leads to deaths are these cardiovascular illnesses. And again, that applies to the hookahs as well that you've mentioned. And it's worth highlighting actually that the smoke from not only cigarettes, but these pipes contains harmful chemicals that cause smoking, which is what I like about the work that we do is to continuously raise this awareness, make people aware, use instruments like assessments. I mean, in our world, we call it a vitality age, where you actually ask people, do you smoke? And where they say yes, you issue educational nudges to just make people aware that it's not as harmless as it looks. It actually is harmful.
And I guess these are conversations that we need to have more of. But Dr. Mabunda, thanks so much for your time. Dr. Mosima Mabunda is the head of wellness at Vitality and speaking to us there as we are commemorating World No Tobacco Day. So for those who are trying to quit smoking, some advice for you there as well.